Good morning, everybody. Thank you so much for joining us today for this update training in September. I just wanted to do a little bit of housekeeping really quick before we get started. We're going to get started here at 10:35 to give everybody a chance to hop on. But my name is Melissa Devine. I'm the site coordinator for Livingston, Washtenaw, Monroe County. I know that we do have some Oakland County MAP volunteers. We're really excited to have you. Just so that you guys are aware, you do have the opportunity to grab the handout for today's presentation through the handout section of the GoToWebinar here. If you have any questions, we ask that you go ahead and put those into the chat box or the question box, or save them until the very end. We will go ahead and address questions at the very end of the training today. Again, we'll get started here in about 5 minutes. I want to give everybody a chance to hop on, and we'll go from there. Thank you guys so much. Good morning again, everyone. For those who are just joining us, we are going to get started here in just a few minutes. We want to give everyone a chance to hop on today for the training. You should be able to grab today's handouts from the handout section of the GoToWebinar. If you are unable to do so, don't panic. We as site coordinators are going to send that out to you guys after we are done with the training today. Also, we ask that if you have questions today that you try to save those for the end, or if you don't want to lose the question, go ahead and type it into the chat or the question box on GoToWebinar as well. We will again get started here in just a few minutes and look forward to the training with you guys today. All right, everyone. Well, we are going to go ahead here and get started. My name is Melissa Devine. I'm the site coordinator for Livingston, Washtenaw, and Monroe counties. We also have on the line with us today Loretta Mack, the site coordinator for Oakland County. Today, we're going to do a training on Zoom, Google Voice, how to record your cost change data, and the Medicare Plan Finder updates. So we're going to go ahead and get started here with the Zoom portion. Just one second here, we're trying to navigate the computer. That's not liking me today. All right, so counseling virtually with Zoom. As many of you remember, last year we went completely virtual for open enrollment. We are doing so again this year with the current surge on the Delta variant. We are really wanting to be safer than sorry and make sure that you guys are safe as well. So we will be hosting our 2021 open enrollment events virtually again. The platforms that we are going to be using are Google Voice for virtual telephonic counseling sessions. And that is, if you're not wanting to use your personal phone, the option would then be Google Voice. We also will be using Zoom for virtual face-to-face counseling sessions. Today, we're going to touch base on the process to use both virtual platforms and let you know when you should be getting your schedules, how long the appointments are, and all of that. So virtual face-to-face counseling via Zoom. The virtual open enrollment event schedule will be sent to you the day before the scheduled event date, or if that happens to be a Monday, we'll send that to you on Friday before the Monday event. Each appointment is going to be scheduled for an hour and a half so that we have extra time for technology and making sure that the beneficiary is on the line with us. You will need to use Wi-Fi to access Zoom on your computer or tablet. If you're using your phone for Zoom, you can connect through your cellular data plan. You will be sent a Zoom license username and password by your site coordinator when you receive your scheduled appointments. That way you can sign into Zoom via their website or their app. The website is zoom.us, and your Zoom license username will come in the form of a Gmail account. So it may be MMAP1B with a number after it, 2, 16, 12, whichever number you're designated to use that day. Your password then will match as well. In order to sign into Zoom for your appointments, you'll need to go to the web browser or to your Zoom app and sign in with the license sign-in name and password that's been provided to you by your site coordinator. If you Zoom on your computer from the web browser, your view of zoom.us will look like the image on the slide. The sign-in link is on the top right of your web page. Once you click on that link to enter in the username and password. All right, so that's kind of what this screen here will look like. You'll enter in that MAP1B Gmail email that we send to you along with the matching password. For this instance on this slide, we used map1b16@gmail.com along with the coordinating password. Once you've entered in that username and password given to you by your site coordinator, you can then log in through the Zoom app or through the web browser. Again, if you're using the web browser, it will look like the image on the screen. To start your meetings, you'll need to hover your cursor over the meeting title to view the start, edit, and delete buttons. Click on the start to begin the meeting. You will be designated as the host, as this is going to be scheduled for you by your site coordinator, which is why you're going to log in using our designated MAP1B Gmail account. If you're using the Zoom app, you'll see that meeting on the side of the app here on the left side with the start button as long as you've clicked on the meeting that you're going to be entering. You can click on the blue start button and it will start the meeting. If you start Zoom meetings from your web browser, you will have the Zoom and you have the Zoom app on your computer or tablet. You may receive or see the screen before you that has a pop-up box. The pop-up box at the top will ask if you want to launch or open the meeting in your Zoom app. If you want to launch it in the Zoom app, click the box that reads Open the Zoom meeting in the pop-up box. If you want to just launch the meeting from your web browser, select the blue Launch Meeting box that is on the bottom of the web page. I've highlighted both of those in red for you today. Once you're in your Zoom meeting room, you may be asked for permission from Zoom. They might want to send you notifications, have access to the microphone, camera, etc. You will want to allow Zoom to send you notifications and have access to the microphone and camera. Notifications are especially necessary so that when a participant is trying to enter the room or are entering into the waiting room, it will notify you and allow you to add them to the meeting. Similarly, if Zoom is asking for permission to send to use your microphone and camera, you want to select the allow button to do so. So then that way, the person that's in the meeting with you can hear you and see you. So there are some buttons for Zoom. Zoom meeting rooms host the same 6 buttons on their screens. You've got the video, microphone, participants, sharing content, switching between speakers, whether you want to see the active speaker or see a gallery view. The video button is a video camera and controls whether your camera is on or off when in the meeting. The microphone button is a microphone, and it controls whether your microphone is on or muted during the meeting. Participant button looks like 2 people next to each other, and when clicked on, will present a drop-down box to show who all is in the meeting with you. If ever you receive a notification that somebody is trying to enter in the meeting, you can access who they are and admit them through that participant button as well. The share content button is a green box with an up arrow inside of it. When you click on the share content button, a box will appear asking to share your content, which we will go over a little closer here in the next few slides. The switch to active speaker button is a silhouette of a person in a box, and when clicked on, will change your meeting view from the gallery, which is seeing everyone who's a part of the meeting on the grid, to viewing only the person who's actively speaking in the center of the screen. The switch to gallery view button is a gallery matrix box, and when clicked on, will change your meeting view from the active speaker only to the view of everyone attending the meeting in the grid. The buttons look the same regardless of the technology you're using, whether it's an iPad, a Mac laptop, Windows laptop, or even an Android tablet. However, they may be placed in different areas on your screen. They could be at the top of the screen, the bottom, etc. You may also need to hover over the button panel in order to see it during your meeting. So if it leaves your screen, and I'm using quotes, if it leaves your screen at any point during the counseling session, just take your cursor and hover over where the button panel sits to view it again. When on the tablet, you can just tap the tablet screen and it'll allow you to view the button panel again. Once you're in a Zoom room with the beneficiary that you are scheduled to counsel, your meeting room will look like one of the 2 images depending on if your video camera is on or not. On the left is an image of the Zoom room with your video camera on, and on the right is an image with both you and the attendee's cameras off. When you do not turn on the video camera, the attendee cannot see your face. They'll just see an image with your name on it. It is important during open enrollment to turn your camera on and allow the beneficiary to see you while counseling. It'll help them to be a little more comfortable too. They'll feel a little safer giving information out and creating a Medicare.gov account with you. Likewise, to making sure your camera is on when in a Zoom counseling session, you will need to confirm that your microphone is not muted. When your microphone is muted on Zoom, the microphone icon will have a red backslash going through it. If the microphone is muted when you enter the meeting room, click on the microphone and Zoom will unmute you. So, some Zoom meeting room information. If you want to view your meeting room information, you can click on the Zoom icon at the top center of the meeting room. It'll provide you a drop-down with the personal meeting room information. It can be used to invite family members that would like to join. So if a beneficiary would like their child to join, instead of having to send an email out with the link and everything else again, you can always give the beneficiary the meeting ID and the password, and they can go ahead and add or give the beneficiary's child, they can give their information that way. You also can reach out to your site coordinator if you do need to add somebody else. We are more than happy to send that information out for you as well. So if you do not allow Zoom to send you notifications, you'll not see the admit button for the meeting at the top. You would then need to admit your beneficiary to the meeting from the waiting room via the participant box instead. Once the beneficiary is admitted to the meeting room, you can view their name under the participant drop box, like you can see on the screen. I made my husband be my partner in crime for this image, so that's who Ralgar is. That's his game name. When in Zoom meetings, you can choose to view the active speaker on a larger scale if you are on the active speaker view. If you want to view all the attendees on the same screen, you'll need to be in the gallery view. You can switch between the two choices by clicking on the gallery view or active speaker view button on the top left. See the circled areas on the slide. When on the active speaker view, the button to click to switch to gallery view looks like the gallery matrix box and states switch to gallery view. When on the gallery view, the button to click on is going to be the active speaker view. It looks like the silhouette of a person on the screen and states switch to active speaker view. When counseling a beneficiary, it is important to make sure that we're sharing our content, whether it's a document or a website URL like Medicare.gov. To share the content with a beneficiary, you'll want to click on the Share Content button on the panel of buttons. And for this slide, it's circled in red. Again, depending on whether you're on a computer or a tablet, may depend on whether it's at the top or the bottom. But in order to share a document, you'll want to select to share content on the Zoom meeting bar. The content that you're sharing will need to be open before sharing, clicking that share button. If you choose to share content through a website, you'll want to select your desired website that you wish to share on the internet browser. Make sure again that it's open currently. And then once you click to share from the sharing content pop-up box here, you'll be ready to share and they'll be able to see the website that you are on. So on the left here, the left image, once we clicked share content, we selected to share a website. We then selected from the three choices here, your entire screen, application window, or the Chrome tab. We selected Chrome tab. From that point, we selected to share the Medicare.gov website, which is why that is covered or highlighted in gray here. And then click the blue share button at the very bottom of that pop-up window. From that point, on the right here is what the web will look like, the web browser. It'll show that you're sharing the tab to the web Zoom meeting, that if you want to stop, you can press the blue stop button here, circled in red, but that they will be able to view the Medicare.gov website with you. Now, if you're unable to share content through just the website, you can share the entire screen. So again, when you press share content, the pop-up box will pop up here. You can choose to share the entire screen, the application window, or the Chrome tab. From there, you'd want to select share the entire screen, which we've highlighted here in red on the left-hand side. Once you click on the screen itself, you can then press the share button at the very bottom. Once the entire screen is sharing, over to the right is what you will see. You'll see the Medicare.gov website, and of course, any other things that you have on your desktop will be visible to the beneficiary. At the very bottom, it shows that we're sharing the entire screen, and if we want to stop sharing, we can press the blue stop sharing button there. So when your counseling session is all done and you're ready to end the Zoom meeting, you can select the end button on your Zoom meeting itself. You can then choose to end the meeting for all or just leave yourself. Make sure that you select that you're going to end the meeting for all. So then that way, when you are headed to your next counseling session, you know for sure that the person that's in the waiting room is who you're supposed to be meeting with. All right, now from here, we're gonna touch base on the virtual counseling sessions with Google Voice. I'm gonna mute myself and let Loretta Mack take over.
Thank you, Melissa. Can you hear me okay, I hope?
We can hear you.
Okay, great. I'm going to be talking about Google Voice. It's an application on the web and on the phone that lets you shield your real telephone number. We used it last year and we will be using it in 2021 as well. It will follow just like with Zoom. You'll be given a schedule with the appointment times and beneficiary information, including their telephone number. Each appointment will be for 90 minutes. You will log into your Google Voice account on your phone or your computer to dial out and start your counseling session with the beneficiary. And your schedule will be emailed to you at least the day before. And if the appointment is on a Monday, the Friday before. Next slide. So Google Voice gives you a single virtual phone number that you can ring on one or more of your personal phones or computer connected to the internet via Wi-Fi when someone calls you using the virtual phone number you select. It can save your voicemail online and transcribe your voicemail to text. Other features include the ability to listen in on messages while they're being left and block unwanted callers. You can create and respond to text messages with your virtual phone number and use the call function to dial or answer calls. Next slide. How do you create or find a Google phone number? The Google Voice app can be downloaded to Apple and Android phones and can also be used on Chrome and Firefox browsers. When making a Google Voice account, you will need a Google account as well as Gmail. When you set up your Google Voice account, call your site coordinator or email your site coordinator if you have any problems or issues using the application. Once you have it set up, you can call, text, or email your site coordinator your Google Voice number. If you need assistance creating a Google account or a Gmail account, contact your site coordinator for more assistance. The first step in setting up a Google Voice virtual number is to go to the website voice.google.com. And you should set this up before you use the app on your phone. Once the Google Voice page is there, make sure that you're logged in to the appropriate Google account. Once you are logged into the Google account, you'll be taken to the screen above, which asks you to continue the process of creating the Google Voice account by clicking continue. Click continue to proceed. Once you click continue, you'll need to select a number from the available numbers list. To view the available Google Voice virtual phone numbers, you'll need to enter in your state, city and state, or an area code into the search bar. Choose a number within your area code. If you can't find a virtual Google Voice number in your area code that you counsel from, look for a number in a city that's next to the area code you initially searched. If you're in Oakland County, you probably should choose a number from the 248 area code, even though Oakland County has another area code 947, but more people are familiar with the 248 area code. Next. Once you've selected your Google Voice number, you'll need to verify the number. To verify the number and complete the setup process, click the Verify button. To complete the verification process, you'll need to link your Google Voice virtual number to your real cell phone number. A window will pop up for you to enter your cell phone number for verification. Follow the prompts to get your verification code via text message to your real phone number and enter it into the window that pops up. After the verification process is completed, you'll see a screen that shows your Google Voice number is ready, and all you'll need to do is click the Finish button. Here's a depiction of the Google Voice home screen. The home screen menu is circled on the left, and it will show various icons The telephone is for calls. Text is next. Voicemail is next. Archive, and then spam. To the right of the screen is the keypad. Your Google Voice number is circled in red on the right, and that's the number that the clients will see that you're calling from, not your real phone number. Next. On the top right is a headset button. Once you have your number, if you log into your Google Voice account from your computer, you would click on the headset button. Once you click on the headset button, it'll prompt a window to pop up in the it could be in the area that's circled in red on the left, but sometimes it pops up in other places. The window that'll pop up will be requesting access to your computer's microphone and speakers. Select Allow on that prompt in order to have your computer speakers and microphone available when using Google Voice on your computer. This prompt may occur each time you log on to Google Voice. Once you have your microphone and speakers connected, you're ready to start your virtual telephone counseling session with Google Voice. The call screen. This is what your call screen will look like on the left. And then when you dial a number in that call screen, you'll see some standard call features on the call screen. Next, when you have an incoming call, it will show on the call screen as well with an answer, green, or a decline button, red, much like your regular cell phone. If you miss the call, it'll show up on your call screen log. And if the client leaves a voicemail, it'll show up under voicemail. Okay, any text messages received or sent will be located on the left for you to view and respond to. Click on Send New Message will allow you to create and send a new text message to the contact of your choice. Google Voice will play a default greeting initially. To set up a customized voicemail greeting, click on the gear icon in the upper right-hand corner of the screen to go to Settings. Once you're in Settings, you'll scroll down to Voicemail, click on the plus sign to record a greeting. Once it's satisfactory, save the greeting and it will be saved as your active greeting. You can have more than one greeting. Next, to set up a customized voicemail greeting, you would tap on the green microphone icon to record your greeting. Once you're done, you will click on the red stop icon to stop the recorded greeting. Click on the blue arrow to play the recorded greeting. If the recording sounds good, click on the Save button to save the greeting. If the recording doesn't sound so good, click on the Redo button to re-record the greeting. Once you click on Save to create the new greeting, you'll be prompted to name the greeting. You'll name the greeting and then click on the green Save button. Next. If you want to change your voicemail greeting to a different recorded greeting, you would click on Manage All Greetings from the voicemail section of the settings window. You must click on the gear icon again to get to this settings window. Once you see the list of greetings, you'll click on the 3 horizontal dots next to the greeting for more options. Click on the greeting that you want to set as your active voicemail greeting and then click Set as Active and you're done. Next. And then on the left is where you can, which circled in red, is where you can listen and view your voice transcribed voicemails. You will need to select the voicemail message you would like to listen or view the transcript of. Once you've selected the voicemail, you'll need to click on the play button for that message transcription to play the audio. So that is Google Voice. I've been using it for about a year on my computer as well as on my iPhone, and works pretty well. So with that, I'll turn it back over to Melissa.
All right, thank you, Loretta. All right, so we are now going to move on to the Part D cost change data. This is the documentation of your Part D cost share changes. So lots of questions typically from individuals like, why do we need to document our Part D cost changes? Who cares? Well, we do this for a couple of reasons. First and foremost, our funders, the ACL, they use this information 3 ways. They use our client contact form information to collect data related to the cost changes resulting from enrollment in Part D prescription drug plans or Medicare Advantage plans with prescription drug coverage. All of this is available through our Medicare plan finder that we use. But the ACL will use our cost change data as a way to demonstrate the impact that the SHIP or our MMAP program works on behalf of beneficiaries. They'll do so through data on the number of beneficiaries who received Part D or Medicare Advantage Part D plan enrollment assistance from MMAP. They'll use it for data on the average cost change per beneficiary who received that enrollment assistance from MMAP. They'll also use the data on the reported total of Part D and Medicare Advantage Part D cost changes for each state. That means that the cost data reported for Part D and Medicare Advantage Part D enrollments must be auditable for the ACL to verify and share the numbers reported. In order for MMAP to do that accurately, that means that we are needing to provide supporting documentation when cost change data is reported. This is all done through the client contact form on ShipTools. We will still document on the client contact form regardless of whether there is a savings or not. Sometimes enrollments do not include a savings for beneficiaries. So when does Part D or Medicare Advantage Part D enrollment assistance occur? Well, that is whenever you actively assist a beneficiary with an enrollment into a Part D or a Medicare Advantage with Part D coverage online through the Medicare's Plan Finder, through the plan's website, over the phone with a plan customer service representative, over the phone with 1-800-MEDICARE, or through a paper application. Whenever you complete an enrollment into a Part D or a Medicare Advantage Part D, please be sure to select either box 6 or box 32 in the ShipTools client contact form. Box 6 is for an enrollment into Part D. Box 32 is for enrollment into a Medicare Advantage with Part D coverage. Once you've checked box 6 or 32, you then need to select the box for the before and after comparison on file and the enrollment confirmation on file. Once all of these boxes are checked, you then are able to add the necessary documents to the client contact form and enter in the cost changes. We will do a live example of this after we've gone through the presentation, just so that everybody's kind of up to speed. But if you are submitting a client contact form and it's not complete before you submit it, any documents that you've added to these sections will need to be re-entered again once you have completed the client contact form before submitting. Again, we'll go over all of this live in just a few minutes. So, how do we report the Part D and the Medicare Advantage Part D enrollment data on the client contact form? It's the 4 steps. We just kind of did a quick overview of it, right? We're going to collect the plan cost information. We're going to assist the beneficiary with the enrollment. We're going to enter our data into ShipTools, and then we're going to attach verifications so that ACL can go back and kind of recreate to the best of their ability. We all know that those numbers are going to change each day as open enrollment changes, but to the best of their ability, they can go back and verify based off of the documents that we attach to our client contact form. So with the first step being gathering plan cost information, we need to do so from the Medicare Plan Finder, or MPF, in order to view and demonstrate the costs that are changing. You'll want to use the view I guess technically it shows your current plan and then it'll show new cost after, but in order to capture this, it's best to do the comparison because you're doing the whole yearly drug and premium cost. It's not just what the medications cost at the pharmacy, it is the whole yearly cost. When this takes place, if a beneficiary is looking at multiple pharmacies, the data is only going to pull for the lowest cost pharmacy. So it's always best when you're doing this to do the comparison, click the box, add to comparison, including their current plan. This will allow us to see the costs from all of the pharmacies. And then that way it'll be a easier auditable verification for ACL. Before this example, MAP Inc. utilized just the screen without doing the comparison. They utilized Cigna Health Spring as the current plan, so the before, and then they utilized Clear Spring Health as the after. So once you've checked all the necessary boxes on the client contact form, and you've added the files that you need to add, you could go ahead and add the current cost, which is the $231.80 for Cigna Health Spring, into the before. And then you'd enter in the $116.40, which is the new cost with Clear Spring Health, as the after. All right. So what if somebody is new to Medicare, right? What if they need a Part D plan or an MA Part D plan because they're new and they want to, make sure that they're not going to incur any late enrollment penalties? Well, if they want to enroll, what you need to do is go into the plan details for the plan that they're looking at. You'll want to capture the screen that shows what the yearly drug and premium cost is for this plan. And then you'll want to capture the cost of the meds that they would take as the retail cost and multiply it times the months that they will then have the plan. So for this example, in order to obtain the original cost, the before cost, we click the plan detail blue box that's circled in red. You look at the negotiated retail pharmacy cost for this original Part D plan. You're going to scroll down to the monthly cost of the beneficiary's retail pharmacy, or if they're using mail order, you're going to multiply that cost by the number of coverage months. So during open enrollment period, that's going to be a 12-month time frame. For this example, it showed that they weren't using medications, so they were going to capture just the monthly premium, which was $25.20, and they were going to multiply it by 12, and that gave them the before number of $302.64. If somebody enrolls outside of open enrollment, let's say they're enrolling in September because they're new to Medicare and they need coverage for 3 months, you're going to do the same thing. You're going to go into the plan details, you're going to find the retail cost, and you're going to go ahead and multiply it by 3. So we can see here, I apologize, I actually told you it was just going to be for the premium. It's actually for the drug cost as well. So they had medications that weren't as expensive. So the red arrow here shows that it's $25.22 for the monthly retail cost of those meds, which is where we got the $302.64 times 12. All right, so we're going to move here. What if we need to report a beneficiary who's new to Medicare or the beneficiary's plan is no longer available? We experienced this last year when JourneyRx pulled out of the game, right? We had a bunch of JourneyRx individuals who needed to get into new plans, and we had no information for this year's info in terms of cost. So regardless of any previous coverage or lack of coverage, we're going to report the monthly cost times the number of covered months that's going to be associated with the new plan. So we go into the new plan, We're going to look at the retail cost. For this example, it's $73.56. And we're going to multiply it by however many months they're going to now have this new coverage. So for this example, this was for somebody who needs coverage for 4 months, September through December. They multiplied $73.56 times 4, giving us the before number of $294.24. The after is what our estimated total drug and premium cost is, which would have been on the previous webpage, $103.20. That's your after. Again, we will walk through this live here in just a few. Okay, so some other cost change situations you may encounter. How should I report when a beneficiary is automatically enrolled into a plan, but MAP assists the client enroll into a different plan? Well, you're going to report the estimated annual drug costs for the first plan that they were auto-enrolled in as the original, so the before, and then you're going to report the estimated annual drug costs for the new plan as the after, or the new cost field. Should I report when a SHIP helps enroll a client in a new Part D or MA Part D plan, but the client doesn't experience a savings or they're going to pay more? Yes, absolutely. You need to report that data. There are several reasons that a beneficiary might select a higher cost plan. ACL is going to collect the cost change data on all of the enrollments, including those that do not result in a saving for a beneficiary. So we do need to make sure that we save all necessary verifying documents, regardless of whether it's a savings or not. What should I report if I help a beneficiary with an enrollment for the current year and the future year during a counseling session? This typically would occur only during open enrollment, right? What you'll need to do is make a sum of the cost changes for each plan and report it on the same client contact form. This is because the contact occurs on the same day with the same counselor as part of the same session. So you're going to report it all together. You're going to need to attach documentation for each plan's application and costs to the client contact form for verification. If you're not comfortable doing that, you are always more than welcome to make more than one counseling session for the beneficiary. All right, what if I help a beneficiary enroll in a plan, but they don't take any medications? Well, if that's the case, you're going to enter in the annual premium cost only for the current or original plan before, and then the new plan after. So let's say somebody is enrolling in a WellCare Value Script plan, then the monthly premium is $18.70 a month. You're going to multiply that $18.70 times 12, and that's going to give you the annual cost. And if they're transferring from one plan to another, the old plan's monthly premium is what you're going to enter into the before, and the new plan's monthly premium is what you're going to enter into the after. Typically, we would probably see something like that take place if there's a newer, lower cost plan for the following year. We don't have all that information yet, but we will have that come October. But if it's anything like last year, who knows? Maybe we'll see something lower than $6.90 a month. Okay, so what should I report if I help a beneficiary enroll in a plan, but the beneficiary doesn't take any medication and they are new to Medicare? You're going to do the same thing we did in the previous example for their after, but for the before, you're going to enter in 0 because there's nothing to compare it to. So 0 would go into the before, and then the annual premium for the new plan times 12 is what's going to come into the after. So what happens if no cost change verification documents are on the client contact form, or retained hard copies and their cost amounts in the Part D, MA Part D before and after fields? Are they always required? Yes. They are always required. There needs to be a copy of that information always when you do an enrollment. Verification documents are semi-annually reviewed through a quality assurance review. And this process is going to include looking at the cost change data reported with the required documentation in the client contact form. I know that this may be an adjustment for some. I know a lot of folks have been used to doing, paper and pencil or not having to enter in that information, but it is incredibly important that you do that. It is also incredibly important for the funding of our program to make sure that we can help our beneficiaries, so that you do report that you've done an enrollment. I know it's a pain to have to put documentation in, but if you don't report that you did that, they're not going to see the benefits of our program. So you will need to make sure that you always enter in all of that information under the client contact form. Will the ACL accept cost verification pages with beneficiary names that are blacked out? Yes, absolutely. It is acceptable to black out the beneficiary's name so long as the plan name is legible. Also, the beneficiary's name is not a required field in ShipTools. You would be able to admit the beneficiary identity if desired by leaving both the name field blank and blocking out the name on the enrollment verification documents that you upload. However, you still need to upload all verifying documents. How should I provide the enrollment confirmation if I cannot get a copy from the beneficiary that enrolls themselves or through the plan website or through calling 1-800-Medicare? Can I still report the cost changes? If you are obtaining the enrollment confirmation in these limited circumstances, and it is not possible because assistance was over the phone through Medicare's 1-800-Medicare or through the plan phone number, list the enrollment confirmation number in the note section of the client contact form, and then upload the Medicare Plan Finder views of the plan original and new costs. If you have questions because you're in a limited circumstance like that, please reach out to your site coordinator. We are more than happy to provide you further assistance. Okay, so now we're going to move on to the Medicare Plan Finder updates. This is a current view of what the Medicare Plan Finder looks like. For those who've been here for a while, you know that it looked a lot different before. But beginning with the contract year of 2022, the Plan Finder will no longer present estimated total yearly costs for care, which would be the estimated yearly cost section of the plan detail overview. The Office of Communications is evaluating solutions that will provide a beneficiary a more comprehensive view, we shall say, one that's easier for them to understand and compare the health costs in the Medicare Plan Finder. This change will not impact the estimation of drug costs generated by the beneficiary drug selection in the Medicare Plan Finder. Users will be able to find in-network pharmacies with special attention given to preferred pharmacies for a given Part C or Part D plan from the Plan Finder details page. I don't necessarily think that that's something that's come up yet. I haven't been able to filter in that capacity. But these are things that are going to take place at some point before 2022. So it could happen during open enrollment. CMS is also redesigning the Medicare Plan Finder plan detail page so the beneficiaries can parse information and locate the most commonly sought benefits in cost sharing. The redesign will include a new drug table that breaks out the cost of each individual drug toward the total annual drug cost. Some of those changes are visible in what the Plan Finder looks like now. The Online Enrollment Center, or OEC form, will be enhanced to improve usability, assisting beneficiaries to clearly select appropriate language for take-home materials, pre-populating email addresses, and logged-in users, or for logged-in users, which, again, we've seen that as well whenever we log into a beneficiary's account. All right, and then CMS is going to simplify the special election period selection page, including limiting other SEP options to be visible only by CMS customer service representatives. We would love for them to make that available for us. We do the same thing, but we have not seen that yet. This change is going to ensure that beneficiaries are not erroneously selecting the other on the enrollment form, but rather selecting what is actually part of their special enrollment period. The OEC form will be updated to include additional SEP codes. Okay, so this is when you, so I did a Jane Doe search and I just kind of tossed in a couple of things here. This one though specifically is from MAP Inc. So when they tossed in whatever they looked at, they tossed in Humulin, levothyroxine for their meds. Okay, so this is going to be a little longer of a view for you, but this came from MAP Inc. so you could see the whole shebang at once. So this would be on the left, the very top of the web page, and as you continue to scroll the web page, you'll see what it would look like because we're going to go left to right. So the right side is what you would see underneath the plan address or the plan contact info. Then you'll see what the estimated monthly total drug cost would be, including what it would be at the CVS pharmacy, and of course, any star ratings that they would have, okay? So since we're to the question area, now we're gonna actually do our live view here. So let me maneuver this here. Let's go to Medicare.gov. Okay, we're gonna do a generic search. We're not gonna log in. And we're gonna look for Part D plans. I'm gonna plug in my zip code, which is for Livingston County. I'm also gonna select that I don't get help from any programs, okay? Because I want you guys to be able to see this for folks who aren't qualifying under special enrollment periods. A lot of our open enrollment beneficiaries, yes, we may see those that have Medicaid or LIS, but the bulk of people who make changes during open enrollment don't have access to a once per calendar quarter special enrollment period. So I want to show you it based off of individuals who don't receive any help. Okay, we are going to view drug costs because I want you to see that. I am going to type in some generic meds that we would always typically see. And then we're going to type in lisinopril, why not? Okay. All right, so we've got everything set up. We've got it for a frequency of every month, and then whatever the typical quantity is that Medicare assumes people would fill at, because everybody is different, which is why you want to make sure you confirm a drug list with somebody ahead of time. So we'll click done adding drugs, and we'll plug in pharmacies. Now, I am only going to select 2 pharmacies so that we don't muddle this too much. And I'm just gonna click nationwide brands because I want you to be able to view things for Part D plans because they offer nationwide coverage. So we'll select CVS and Walgreens. We are going to make sure that we are sorting our plans by the lowest drug cost and premium. That is going to be super important, especially for open enrollment. So we make sure we get somebody into something that is going to be the lowest cost for them through the rest of the year. Now, we don't have access to 2022's drug info yet, but let's just pretend that this person is going to look for a plan during open enrollment, okay? What we need to do is do a comparison. Let's say Silver Script is the new plan they're looking at, and that Clear Spring was the plan they had before, okay? We know that this number will probably be larger just because this is only going to show us the remainder of the year, October through December. But we want to compare it. And what we want to do is we want to print this document. This is what you're going to need for your before and after if you're doing a Part D comparison. Okay. That way, whenever we enter in our before number, if let's say they're going to go to CVS, we enter in 4680 for the before and 2070 for the after. Saving this document twice on our client contact form is going to help us ensure that the ACL can track what we did. This allows them to walk back and say, okay, when they looked at Clear Spring Health, the current plan, they realized it was more expensive and that there was a less expensive option out there for them based off their meds and the pharmacy that they want to go to. Cool. Now we know why it says 4680 before and 2070 after. So once you save the plan details, you can do a print. Right up at the top right of your web page is a print button here. It's going to be right underneath the login area. If you click print, you want to save it. You want to make sure your destination is a save as a PDF. Some might just say PDF, print to PDF, save to PDF, whatever it is, make sure it's going to be a PDF. Don't save it as a OneNote for Windows 10. Don't save it for anything else. Make sure it's a PDF, okay? You'll click the Save button. And let's go. I have a beneficiary document folder. Being site coordinator, I have to save hard copies for everybody, so that's why you see all the names. But we'll go into mine here and we'll just type in J Doe, and then we'll type in September 2021, because that's what we're doing here. And then I'm gonna type it in as comparison, okay? Now, we save the document. If I go and log into, well, it's gonna make me log into my Ship Tools. Hang on one second, sorry. If I log into my Ship Tools and I wanna enter in a new client, I'm gonna select Add New Client. Let's type in, we'll go Jane Doe, we'll fill in all of our necessary information, right? We wanna fill in the client information, and anything with a pink bar next to it is required. So let's say she lives in Howell. I'm gonna wanna, at the very least, enter in Howell and enter in her zip code. The client county and the township will auto-populate. And then I will wanna enter in contact information. Did we speak through home phone? Did we do an email address? How did we do that? Maybe the beneficiary has a representative with them. If that's the case, I'm gonna click Show Representative and enter in all of that information as well. I wanna make sure that I fill in the date that I had this contact, how I had the contact. For all intents and purposes for our open enrollment period, if you do it through telephone, you click telephone. If you do it through Zoom, click web-based. If you spent time going back and forth with them through email, select email. Then we're gonna wanna enter in our time. That's gonna include any time that we utilize after the counseling session to send them documents. So maybe they want a Medicare and U book sent to them. You're gonna wanna, however long it took you to get that Medicare and U book sent to them, whether it's electronic or through the mail, that's a part of that counseling session, okay? So fill in the appropriate time, hour, and minutes. You also wanna make sure that you select their status. Are they in progress? Do you have another follow-up session with them to go through other things? Maybe this counseling session, they just wanted to get a view of things and they don't want to make the enrollment right then and there. That's okay. You can make a follow-up appointment with them and mark this client contact form as in progress. Now, if you did a client contact form or a counseling session with them and you did the enrollment and they're all done, click completed. It is best for us to get a date of birth for the individual. However, if they are not willing to give that information, we can enter in their age range. But the more specific we are, the better. We can collect their gender, primary language, their asset limits, their annual income, whether or not they're disabled. If they're under 65, yeah, they're Medicare disabled, right? But if they're older than 65, they're not Medicare disabled. Now they've aged in. If you don't collect their age at all, then you still have to enter whether they're Medicare disabled or not. So it is much easier for you and them and us if you just go ahead and collect that demographic information. If you are unable to collect their ethnicity or race, you can select not collected, but you will need to select one of the options. And of course, if they're a veteran, please select their status there. This, however, does not require a button selection. When it comes to how they learn about us, it is important that we ask them, how did they learn about MAP? Did they reach us through the Area Agency on Aging? Maybe they saw a flyer at a senior center, or maybe they're a prior contact. Either way, we want to select the appropriate box here. Okay, so for the example that we were doing, it would require us selecting box 6 in the topics discussed because it is a Part D plan. So we will click box 6, and then underneath it comes these other windows. See how when I hover over the before and after, it doesn't allow me to enter any information in? That's because we have to select the before and after comparison box, which now pops up with a box to put in the date that we did the comparisons, along with an opportunity to choose files to add in. Still, not able to enter any before or after info in because we have to check the box that says enrollment confirmations on file. Again, enter the same information. So for all intents and purposes, we did the counseling session today. I always run through and just enter in all my dates at the same time so I don't forget. Then I'm going to want to go and select the box that says choose file. If I click on that, it will allow me to then go to my documents and go to the folder I need to get that information. So we know that I saved it under JDO September comparison. Because I had both plans information on that one document, that is the only document that I need to put into this, okay? So I'm going to use the JDO September comparison for both the current and the new plan file. So I'm going to go through again. I can also type it in if I want to just type it and don't want to search for it. And then I'm going to click open to upload it. Now, if I had an enrollment confirmation form, I would also go into that same file folder and grab that, but I don't have that for this example. So if we toggle back to our Medicare.gov comparison, typically any person is going to go for the lowest cost plan, right? So they're going to go for the lowest cost pharmacy if they're willing to change their pharmacy. So for this, we would put, again, with Clear Spring being the current plan, $46.80 in the before. So, whoops, $46.80. And then we would enter in $20.70 as the after. Once we have completed our whole client contact form, if we save this information, it will auto-populate the difference between the two numbers. You don't have to find anywhere to enter in a total or anything else. You will need to make sure that you check any supporting topic boxes here, especially if somebody is new to Medicare. So let's say that this person is new to Medicare and they're looking for the lowest cost plan. Well, instead of saving the comparison like this, we would want to go to their plan details. If we go to their plan details, we can look down here. Oh, hey, they updated this. This is new, yay. See, this is why we're doing the live feed here. They typically didn't have that green preferred box next to the preferred and network pharmacy, so that's cool. That should automatically trigger to you guys that that's the preferred pharmacy. Of course, Walgreens is out of network. But what we would want to look at on this page, we'll print it and save it as a PDF just like we did before. But the information that we will use to enter into our before and after boxes is going to be the total yearly drug and premium costs. So if you look at it on this form, for a new person, they're going to have a zero cost before, right? Because they didn't have a plan that we can compare it to. And then we would enter $20.70 as the after, because that's the new plan. But if you select, because they're new to Medicare, if you select box 82, new to Medicare, I'm sorry, box 83, new to Medicare, then you can document in your notes. Jane Doe, new to Medicare, per her request, did plan comparison. Jane Doe requested enrollment into whatever the plan she enrolled in. And if her case is complete, client is complete. It's very simple to do. It seems like a lot. It can be a lot, but that's why we want to give you guys enough time for your counseling sessions. And of course, if you're getting too bogged down because the counseling session is taking up the full hour and a half and you don't have time for documentation and you need assistance, reach out to us site coordinators. We are more than happy to help you with this. We want to set you up for success, not failure. So please, 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 please reach out to us. Also, what you should be doing is creating a Medicare.gov account for them. The best way to do that is to just organically in conversation say, okay, I understand that you're looking for an enrollment change this year. Do you have a Medicare.gov account? If the answer is no, then I would say to them, well, let's go ahead and create a Medicare.gov account for you. This will allow us to view a personalized search for you based off your medication list. It also will allow you to review the medication list prior to enrollment. It is easier just to say, let's go ahead and do this. If you say to them, well, would you like to? They will more than likely say no, because they don't want that. They don't know what it is. They have no idea. Clearly, Medicare's Plan Finder is something that we're going to utilize more than them. So it needs to be, let's go ahead and do this for you. This will allow us to do what we need to make sure you're going into the best plan for you. And if they are still adamant at that point that they don't want it, okay, fine. We're not going to twist their arm, right? We're not going to make them do it if they're very, very adamant that they don't want to. But you need to give it a shot and try to get them a Medicare.gov account. It will be much easier for you and them in the long run. You will save their username. You can absolutely log their username into this box 8 here. Password should not be filled with their password. It should be their password hint. So maybe it's their security question, like I think their choices are like, what's your favorite book? You can enter in what their favorite book is. You know, the password is something they should retain in their file for future. And you can tell them, we don't keep this information on file, so please make sure you write down this password so that when you speak with somebody in MAP Next, we know exactly what we need to do to log in. Okay, so that's how you're going to want to upload all that document information. Again, if somebody is new to Medicare, even though it's not going to result in a savings, you still need to enter in the information. These things are going to change throughout the course of the next coming months. So we're going to be in this together. If you have questions on this Plan Finder website, you reach out to us site coordinators. We are happy to help. If I was doing this counseling session for somebody, I would, of course, make sure they know what the total yearly cost is going to be. But also, maybe they want a breakdown. Well, if you're going to CVS Pharmacy, it's $0 a month for your medications. Why? Well, let me click the CVS Pharmacy plus sign here. Oh, it's because you're getting, more than likely, a preferred generic medication. That's why the retail cost is so low, and that's why the cost is $0 before deductible and $0 after deductible. Because your medication cost is so low, regardless of retail or cost before or after, you're never going to enter into the donut hole. So this is not even going to be a situation for you, right? Those are the kind of things that I would mention to them, okay? I'm trying to see if it shows us on here. I don't see anywhere where it'll show us whether it's a preferred generic or not. Maybe that's something they're going to share with us later. Again, as this changes, we as site coordinators are going to do our very best to bring that information to you guys so that you have it ahead of time as well. All right, so that is that. So if you have any questions, we are more than happy to answer them. I'm going to look through this chat box to see if I see any. And all I saw was myself making sure I wasn't echoing. Let's see, in the questions, I don't see anything in the question box. So if you've got your hand raised, we can do that.
Melissa, can you hear me?
Yes.
Okay, I just wanted to say one thing. The information you were looking for was the tiered information?
Yes. You found it somewhere?
It's at the bottom, way at the bottom.
Oh, okay. I see this. Here it is.
Yeah, view more drug coverage.
You know what? I skimmed over that because it looked like it was nothing. So there you have it. See, Loretta found it for us. So if you click on the view more drug coverage, that's where it's going to show you whether it's the preferred generic and all of that. So yeah, tier 1 preferred generic med for those two. So very good. Excellent. All right, well, any questions from anybody? I'm not seeing any hands raised. Does everybody just want to hop out early because it's almost lunchtime and everybody wants lunch? I get it, trust me.
I think we're good.
Okay, so I am gonna stop the recording of this. If you happen to have questions that you want to ask afterwards, please feel free. So